Good morning, everybody. I'm really pleased to be here with you. I want to share with you my experience in microfocus ultrasound. The title of my presentation is How to Maximize Clinical Effectiveness with a High Intensity Microfocus Ultrasound for Face and Neck Lifting. My name is Antonino Araco. I'm University of Rome, Italy. Okay, when we go to microfocus ultrasound, what is an overview, what we needed for tissue contraction and tissue regeneration in our practice in cosmetic medicine. Tissue contraction means clinical result on face lifting. Tissue regeneration means clinical results on tissue quality. Now, if we go to aging process, we know that when we get older, we are first of all loss of volume, and the loss of volume can be replaced with filler. And when we go back to filler, we see that in face, we are spaces, fat pads where we need to replace the tissue and fat. And when we go back to skin quality and laxity and ptosis, we know that the best indication is for microfocus ultrasound. Now, when we go again back to aging process, we see this article of my friend Val Lambros that he was back in cosmetic surgery in aesthetic surgery journal very recently in 2020. He went through the aging process and follow patient for years, and he saw that when we get older, we see that the losing part of the tissue, the face, results on nasolabial fold, increased labia fold, the marionette lines, and loss of definition of the mandibular lines. And this is a study that he went through all this with a very, very nice and precise assessment of what happens when we get older. Now, again, back to anatomy. Now, when we go through getting a face rejuvenation, obviously we need not to focus on the skin, but we need to focus underlying the skin when we have the facial muscles and the SMAS. Because when we go back to SMAS, we see exactly that what we need is focus and target the muscle. The muscle here, this is the SMAS, and this is platysma, just behind the skin. Also, when we go and see live, when we perform face lifting, we better see that down the skin, here we have the SMAS tissue. There you go. You can see the SMAS tissue. Why all this is important? Here, this is SMAS. I just want to see you when in surgical facelift, we disconnect the SMAS and we pull the SMAS. Obviously, this is surgery, but we have no surgery. We need to use a technology that really targets the underlying tissue. And with microfocus ultrasound, we can reach this. This is the technology, the wave just focus down the skin at some specific points. This is a special instrument that really is called centerless, that center the underlying tissue. And we go through 4.5 millimeters when we want to target the fascia, 3 millimeters we target the subcutaneous tissues, and we target the dermal, you see 1.5 millimeters. Here we go. The research is just back, you see, in 2013. A lot of different articles went on the library, and this article focused on evaluation microfocus ultrasound for the technique, for the safety in combination with other technology. And the clinical indication, this is a very important point. This is one of my articles back published in Aesthetic Surgery Journal in 2020, and I divide my groups of patients in 5 different groups and see was the assessment for these groups. And in my opinion, the best indication is for groups 1, 2, and 3, according to my scale. 4 or 5 groups, when they have a very severe ptosis on face and neck, are not really indicated for microfocused ultrasound. This is an example for group 1. This is an example for group 5. You see that the ptosis on the face and the neck is very, very important, and these are best indication for surgery. Now, clinical assessment, digital assessment. This is what we do for our clinical assessment. We use special device that let us to reproduce the face and follow the results, because not so simple in all cases to show the difference in terms of skin laxity and correction of the ptosis. This is the assessment before the procedure. This is the assessment before the procedure and the result after the procedure. We can also, in terms of research, can monitor and count the level of the traction. This is another instrument that is important for us, because for this instrument, we can follow the nasolabial fold and we can follow the traction of the face. You see the back result. This is the deep line on the nasolabial fold before and after the treatment. You see the reduction of nasolabial folds. It means that the face has been lifted up. That is the difference. You see also on this back image, before and after, is a better contouring. Operative scale. Obviously, we back in this technology since about 7 years now. These are all the preoperative markings. This is one of the whole instruments that is like a mechanic instrument, the mechanic machine. You see, the mechanic machine, we stay close on a point and the transducer go forward and backward and release the microfocused ultrasound. This is a technology I've been using since last year. And what we use now is something completely different, is the microfocused ultrasound delivered in a very, very quick and speed mode. These are really revolutionary, the treatment for the microfocused ultrasound. My personal experience is since 2014, over 1,000 patients. This is the scale divide in terms of age. You see that between 40 and 65 is the main age of treatments. Most of all are female, but the man's getting more and more. This is a distribution about the scale that we set it up. You see most of the patients between second and third groups. This is the article that I published in 2020 for this large cohort of patients. Was a prospective study on clinical efficacy and safety of single session Microsoft ultrasound, single session. Clinical result, this is before and after. You see that the better quality of the skin, the improvement on the mandibular line, improvement on the nasolabial fold, improvement on the submental area and the neck. You see the before and after. With this computer system, is very, very precise, the difference, set the difference on the main head position. See the better quality also on the submental line on the neck. Is another point. I want to show you this slow motion. You see the before and after, much, much better quality. This is before, and this is after. Look, skin is fullness. This is another point. Before and after, you see that the better quality is an improvement, better mandibular definition. This again before and after, better mandibular line, reduction of the nasolabial fold, reduction nasolabial fold, better face contouring. This and again. This again. See the laxity here. It was in a between group 4 and 5, and see the laxity, better mandibular contouring, better submental area, better nasolabial fold. The difference is evident and significative. These are around the eyes. The lower lids, it's a difficult area, the lower lids, because we really cannot do much in terms of filler, and we can work on muscle lifting, and we can work on the skin. That's the neck, and I want to thank you for the attention, and I hope all you very good things. Thank you very much.